So I'm going to introduce Katie from Weill Cornell, and she's going to talk about the disease concept model, trying to understand the lived experience in Syngap.
Hi everyone, my name's Katie Cunnane. I'm a third-year medical student at Cornell. I'm actually Dr. Greenspan's student. He was here earlier today. I just wanted to thank you all for having me. I'm super excited to be presenting amongst so many research powerhouses. So I am presenting on creating a disease concept model for Syngap. So first, I just want to define what a disease concept model is. This is an entity that seeks to answer three questions. So the first is, what are all of the symptoms that make up a disease? So in this case, what are all the features of Syngap? The second question is then, of those symptoms, which do caregivers care most about, which are most important to them? And then the third question is, how do we make this information applicable, and how do we turn those important symptoms, according to caregivers, into clinical trial outcomes that we can objectively measure in future clinical trials? And the reason that we started this project is because Dr. Greenspan himself is gearing up to do a clinical trial, and I know a lot of you are too, and we just want to know, what should we measure and how can we measure it? So in order to approach creating a disease concept model for Syngap, then I did 6 things. I started with a literature review because, as all of you know, a ton of amazing work has been done in the past decade to characterize Syngap. After that, then I looked through providers' charts, specifically at Cornell, to see which Syngap symptoms they were talking about in their notes. Next, I did a set of caregiver interviews. I did them over Zoom. I've met a lot of you over Zoom. It's been amazing to meet you in person today. Thank you. But with the caregiver interviews, I just explicitly asked caregivers, what symptoms does your child experience? And also, which symptoms are most important and most challenging to you? Then I sent out caregiver surveys and provider surveys, which reiterated those questions of which symptoms are most challenging, what do you want clinical trials to focus on? And then after identifying which symptoms could potentially serve as meaningful clinical trial outcome measures, then I went back to the literature to find tools that have already been validated to measure these things in more of an objective way so that they would be ready for use when these clinical trials really start. So here are the results of the question of, what are all the symptoms that make up Syngap-1? And I think that this was really beautifully described in the last talk and very much overlaps with it, so I'm not going to go through the list of symptoms comprehensively, but I'll just point out some interesting things from this data. So you can see that there's kind of this core list of Syngap symptoms. However, each modality, the literature, providers' charts, and caregiver interviews, all provided a little bit of unique information. So for example, some of the things that caregivers were talking about in their interviews have not been formally documented in the literature. And those were things like heat or cold intolerance. So caregivers just kind of casually saying to me that, like, my child doesn't sweat when it's hot outside, or lack of satiety, like my child does not feel full. And then similarly, there are some things that have been described in the literature that caregivers were not talking about as much in interviews, things like tremor and microcephaly and strabismus. And it's unclear from this data whether that's because children don't experience those symptoms as frequently or if they're just not top of mind for caregivers. So as mentioned, after asking the questions of what symptoms make up the disease of Syngap-1, then we wanted to determine which of these symptoms are most important to caregivers. So the first way that I tried to answer this question was, again, through my caregiver interviews. And here what I'm showing is which symptoms do caregivers talk about the most, just organically. So on my y-axis, I have a list of symptoms. These are all the symptoms that just came up in conversation when speaking with caregivers. And then my x-axis is the total number of mentions in all interviews. So for example, if the first caregiver I interviewed mentioned behaviors 3 times when I was talking to them, and the second caregiver I interviewed mentioned behaviors 2 times when I was talking to them, that number on the x-axis would be 5. So I think you can appreciate here that by a lot, caregivers were focused on behaviors, kind of the most in conversation, and then communication, impaired gross motor skills, intellectual disability, and eating difficulties were all kind of talked about a similar amount after that. Something that was somewhat surprising to our group, because Dr. Greenspan is an epileptologist, is that seizures and epilepsy weren't really the primary focus when caregivers were just asked about what symptoms does your child experience and what's most difficult for you. I know this slide has a lot of text, but I will explain it. So in transitioning from the caregiver interviews to then having content to then send out to caregivers for surveys and as provider surveys, we wanted to operationalize some of these symptoms. So we wanted to kind of spell out, especially with some of the more vague terms, what does this really mean? So for example, instead of just asking caregivers about emotional regulation, we created this definition based off the interviews where we define them as outbursts, tantrums, trouble transitioning from one thing to the next. Similarly, with intellectual disability, we define it as difficulty understanding other people's thoughts or feelings, difficulty understanding abstract concepts, or difficulty understanding and carrying out tasks. Again, we just wanted to make these more clear, and these definitions came directly from examples from the interviews that I had. Another key difference between the caregiver interviews that I had and the surveys that I sent out is that instead of just saying the term behaviors, as put on the last slide in reference to the interviews, we broke that term down into restrictive or repetitive behaviors, aggression, and impulsivity, just to be a little bit more specific with the term behaviors. But basically, we use this as a multiple choice question and then ask both caregivers and providers of Syngap 1, in your opinion, which features of Syngap are the most important for a new treatment to focus on? And these are the results we got from that. So on the left, we have what the caregivers responded. Again, thank you to the caregivers for answering my survey. I know it's a lot of people in this room. And on the right, we have the providers. So you can see when asked this question, both caregivers and providers seem to be in agreement that the top two things for treatments to focus on would be intellectual disability and seizures and epilepsy. They also both regard emotional regulation as a very high priority as a target and something to measure in clinical trials. And then communication is also something that was very important to caregivers. So to kind of summarize this data and put it together, what we walked away from the interview and the surveys with is that seizures and epilepsy, intellectual disability, communication, and emotional regulation are symptoms that are important to providers, but also important to caregivers. Not to say that the other symptoms on the slide are less important. I know that every child presents very differently, but these are some of the potential things that we could measure in clinical trials. And so as mentioned earlier, what I did with this information is I went back to the literature and I tried to find tools that have already been pre-validated that we already use to measure these symptoms in more of an objective way. Something I want to mention here that's kind of a shameless plug is for emotional regulation. As mentioned, my PI is an epileptologist, so we're not as comfortable with kind of determining tools that could objectively measure emotional regulation. So for the neuropsychologists in the room, or anyone really, if you have recommendations as to specific scales that are good for emotional regulation, we would love to hear more about that afterwards. And then just a question that we have in general as we wrap up this project are these measures that we have found appropriate, or does this subpopulation need new novel measures to measure these things, because these scales were not made with Syngap children specifically in mind? So just some quick conclusions. With some therapeutic targets that were identified through this study were seizures, cognitive impairment, communication, and emotional regulation. Just an interesting discrepancy in the data is that when caregivers were interviewed, they talked about behaviors a lot, but when the specific question was asked of which symptoms are the highest priority for new therapeutics to treat, it was intellectual disability and seizures that kind of came to the top. Some limitations in this study, we would love it to be more representative, and it's also a small sample size. We only had 5 providers because we only wanted to include providers that consistently take care of Syngap patients. But with that, I just want to say thank you so much to SRF for being so incredibly supportive, for funding my research. I want to say thank you to my PI, Dr. Greenspan. He's not here anymore, but also thank you to all of you. It honestly makes me emotional to be here and meet you in person. So.